Hello, my name is Dr. Andrea Villa Barlam. I'm a licensed clinical psychologist and behavioral health consultant for neighborhood health care. My experience with telehealth prior to COVID was actually zero. I had no experience. And so I had to learn very quickly, but I also knew that we needed to continue to provide services to our patients. When COVID hit and we transitioned to telehealth, I also was sent home for a week to quarantine. And so my thoughts were, how am I going to get back to the workplace? How am I going to do my job? How am I going to provide services to my clients? And what about that week that I was out? What's happening to my clients? So I was very excited to be able to do telehealth and to learn, to jump on board and, to reconnect with my caseload. And also, I guess the initial difficulties that I had were doing like intakes, the new patients, and seeing what their experience was. Like at this point, I have patients that I have never seen in person for a year, but we have a very good rapport, and I look forward to meeting them someday, hopefully soon. But I've been able to work well with telehealth and are seeing many more patients than I ever saw in person. I see many adult females that are mothers and they're busy with their families and their children, so they really appreciate the time that we have together. Also, the ability to speak with a professional in their home environment. It's just so much more beneficial for them that they're very thankful for telehealth services. I think as a clinician and having to do telehealth, it's hard to keep track of all your patients. And the resources or recommendations that you have made to your particular patient. And so reviewing your records is really important. Identifying what resources the person needed, so that at the next session you're able to ask them, well, were you able to follow up with like a housing assistance program? Did you get connected with childcare? Have you visited the food banks? And for some of my undocumented clients, they've had to check with their attorney first to make sure that that doesn't interfere with their residency process. That I've had a woman who was has been applying for her residency for 4 years, and with the pandemic, she was out of work and didn't have money or food for her family, and she was so afraid to get assistance because that would interfere with her residency application. And so we were able to provide her with the food banks and also have her talk with her attorney as far as how she could receive some community resources without affecting her application status. I was surprised with telehealth that I have become so comfortable doing telehealth that I have some anxiety about seeing patients in person again. And I've been in the field for 32 years and all of my experience, 31 of it, has been face-to-face. And now at this point, I have anxiety about seeing patients in person. I've seen many unexpected benefits to telehealth as far as being able to meet the patient where they're at, increased flexibility, also improvement in overall functioning with consistent therapy. That sometimes it's really surprising to see the growth that our patient population can have. As a matter of fact, this morning I had a session with a person that I hadn't had contact since January, and I felt like, oh, that was a bust. She fell out of treatment. But what I learned is she got a job, she's working full time, and that her symptoms are managed and that she's doing very well. And so that was like a feather in my cap. I felt really happy that this particular patient is doing really well.